The topic of cancer is something very personal to me because my wife is a cancer survivor. And I remember when my wife was pregnant with our second child and she was found to have cancer, I went through all the stages of grief. I went through the denial, I went through the anger, I went through the frustration. And so, although I'm a physician, I felt like it was something that I learned a lot about what it feels like to be a patient and to be given that diagnosis. When you are told your loved one has cancer, your whole world changes from that moment forever, and it will never be the same. Unfortunately, what happens when you have cancer is you go into survival mode, and the only thing you're thinking about is beating the cancer. You want to have the best doctors, you want to have the best treatment, and you want to have the best chances of surviving. Unfortunately, despite all of our advances, there are many cancers that there are still no known cures for. And the best that medical care can hope to do is prolong survival. And I think for hospice and cancer, it's a transition that patients can identify when the right time is for them to make the transition. The way that we talk to our cancer patients is by talking about what their goals of care are. And early on in the cancer diagnosis, the goal is always cure, because everybody wants to be cured of cancer. If you've passed beyond the hope of a cure and you're still working on treatments that are effective, of course you're going to continue those treatments. But in all forms of cancer, you reach a point in time where the burden of the treatment becomes almost worse than the disease itself. And we feel this is the time when families should change the question they ask. The question that patients always ask their doctor is there any other treatment you can give me? And we would like patients to ask that question, but we would also like the patient to ask these two questions. What will happen if I take that treatment versus what will happen if I don't take the treatment? And then the most important question that I think you can ask the doctor is, if this was your wife or your mother, what would you do? Because as much as we don't like to think about giving up against cancer, we have to talk about what it's going to mean and what it's going to look like if we continue to press on with the treatment. And there are a number of studies that show that patients who have a limited life expectancy due to their cancer rate the quality of their remaining life is better, the quality of their pain control and symptom management is better, and the overall satisfaction with their life is higher when they receive excellent and aggressive hospice care. And people may think, what do you mean by aggressive hospice care? I mean, we are going to attack your pain like your oncologist was attacking your cancer, and we are going to throw everything at it that we have to until we bring your pain under control, because no one should be in pain, no one should be alone, and no one should suffer, and you don't have to.